So today we are entering, this is the second class in our series of how to get started sessions. So today we're almost getting to halfway through the course, and the topic for today is intervention mapping, and we're going to touch a little bit about evaluation. We have three objectives. So by the end of the class, you should be able to address these issues. First, we're going to describe intervention mapping. Then second, we're going to look at the 6 steps that are involved in intervention mapping. And then the third objective is to try to look at how we implemented these 6 steps in our own serious games that we developed in the lab, in our own serious game. So maybe you ask yourself, why should we be focusing on intervention mapping? Because maybe you are public health students, and so maybe you are learning these things already in other courses. Well, on the first lecture, I mentioned that serious games are actually 25% technology. The rest, the 75%, is where behavioral science come in, where epidemiology come in, where other technical expertise actually come in. And as you can imagine, you need to actually work or collaborate with many other different experts. So this class will really help you to try to find a way to bring all the other experts together in collaborating, in designing and developing a serious game. So first, I'd like to begin with this slide. It's one of the slides I learned when I was a master's student through Masako Sensei's class in social epidemiology. It's the value chain in behavioral change. Did any one of you take this class or learn about this slide or remember this slide? Anyone? Maybe not. Or maybe you will once I start showing how it is. So usually in public health, you have an organization or a research group or someone interested in behavior change, or even government at times. And they do what they need to do to develop an intervention. They identify a problem, a health problem, and they want to change the situation. So they design the intervention. And at the other side of the spectrum, you have the user, you have the audience, the target audience that is set to receive this intervention. And oftentimes, not always, but oftentimes, you find that we receive, as public health officials or epidemiologists, we receive unfavorable feedback from our target audience. Maybe because they didn't like the intervention, or maybe because they didn't thought it was suited for them or something like that. So there's only one winner in this scenario. It's the organization, because the life of the organization goes on. It never stops. Even if the intervention is unsuccessful or successful, it never stops. So the organization wins, but the audience loses out because they didn't like the intervention. So there's no value exchange. But in another scenario, you have the situation a little bit different. You have a situation where both the organization or the social marketer and the audience both win. The intervention is developed based on the preferences of the audience, and as a result, the audience like the intervention and give positive feedback. So partly the reason we are having this particular session today is to try and help you think about ways to make sure that your intervention that you're thinking about is built on the preferences of the audiences. Okay, so actually, intervention mapping was designed by a certain professor who felt that there was no particular theory or model or framework that really addressed how to bring literature, how to bring stakeholders, how to bring the audience together to design an intervention. He says in one of his papers that he received questions like this from his students, like, how do I decide what intervention method to use? I'm doing research, I want to improve condom use, but how do I decide which method to use? There's so many methods, there's so many examples, but how do you decide on one particular one? But there was no guidance prior to this model, the author says. Another question is, how can I get from program goals and objectives to specific intervention strategies for program participants? Another question was, how do I link program design with planning for the program and implementation? How do I link from design stage down to implementation? So I think this is one of the frameworks that really help us try to link those two ends together. So the authors write that intervention mapping is intended to make steps in planning interventions explicit enough to demystify the process to facilitate collaborative planning by individuals of varying background, so the interdisciplinary part of it. And then they say that unlike a roadmap or a guideline, the framework is interactive. The planner is expected to return to earlier steps in the planning stage, even if they're in the last stage, to refine what they already do, they already done in previous steps, such that they improve as they go in. So it's not just a roadmap or just a guideline. You cannot return back. So it's built for people to move from step 1 to 2, go back to 1, 3, 4, 5, go back to 3, that kind of arrangement. So intervention mapping aims to ensure maximum efficiency of health promotion programs by ensuring that the needs and perspectives of 1, stakeholders, 2, the end users of the programs, and then 3, evidence in the field. So linking all these things together in designing or developing the certain intervention that you are looking at. And in our case, it's probably serious games, right? So here are the 6 steps that are involved in intervention mapping. The first one is needs assessment. The second one is program objectives. The third one is theory-based methods and practical strategies. The fourth one is program design, program implementation, and the evaluation plan. It sounds straightforward, right? Pretty much straightforward. We can almost figure out what activities go in these different stages, right? Okay, in the next few slides, I'm going to give you some detailed tasks that are involved in each of the steps, the 6 steps. And in these slides, I would like you to reflect back on what you as a group were able to write, what you missed, where you got it right, and just reflect on that as we continue. So let's first look at the needs assessment. So before the intervention, the intervention of behavioral change, we need to do the needs assessment. In doing the needs assessment, so first we need to establish a working group. We need to establish a working group of technical experts, stakeholders. Stakeholders means people of other organizations. If your intervention is in Kyoto University, you need to probably work with people from the hospital, from this department, and from another department, or from administration. So stakeholders. You need to involve stakeholders. And then you also need to consult with the users of the program you are designing. they should be part of your, ideally, of your group. So establishing this planning group, aim for breadth and depth of the knowledge that you will get. And then start on to conduct the needs assessment, describe the population and the health program very clearly in a way that is able to measure. You have to define what is the program, who is affected, and how you can be able to input any intervention. And then also there's environmental aspect. You need to survey the environment in terms of policies, in terms of group norms. You need to understand the environment very carefully. And there is a model or a framework that is popular in this intervention mapping. It's called the precede, proceed actually. This model diagnoses the population you're working with. It diagnoses many factors that contribute to the program you're working with. And then it also guides a team to assess causes of health problems at multiple levels, at individual level, interpersonal level, organizational level. This model helps you to diagnose different problems at that stage. And then also at this stage, it's when you first initially write down the problem. The program goals, the problem, you specifically state it down at this stage. And I want you to notice that this is not the final time you will write the goals of the project. The goals of the project might change as you gain more information, as you do your reviews. And in literature review, it can be, it can be primary data. It can also be secondary data. You can review other people's work, or you can use data from different sources, or you can go out and conduct the research yourself. So it can be different. So next, I want to share some of the steps that we actually did in Swazi-Yolo study. First, we established a working team of collaborators here in this department. And then we also established collaborators in Ministry of Health in Swaziland and some non-governmental organizations and game development company. It was in Cape Town, as well as a game publisher in Japan. You can see that already this team is multidisciplinary. You have people from the game aspect, you have people from Ministry of Health, you have people from NGO. These people are going to help us actually know what is acceptable, what the situation is in terms of policies to change behavior in Swaziland. We didn't want to just go off on a tangent. We wanted to already, the intervention was going to be built in the strategies and priorities of the country. And the only way you can know this, apart from reading policies, is to involve the policymakers within your team. So we did a lot of consultation between Japan, South Africa, and Swaziland. And as you can imagine, it might be very difficult to get everyone to sit down in a meeting like this. So it was a lot of moving up and down to collaborate on this. And then also we specified the overall goals of the intervention. And I want to mention to you that at this stage, we didn't have funding. So you want to design an intervention, but you haven't set out the goals yet. So there's no funding. But you need to collaborate with partners to understand what's going on in the situation. But you need money for that. But there's no funding at this point. And you don't even know if you will get funding or not, usually at this stage. So it's quite interesting. Now I can talk back and list very nicely the steps that we did. But actually there was a lot of uncertainty in each of the steps. Right. So if you can imagine speaking to someone, Minister of Health in your country, telling them that you're thinking about designing a game for HIV prevention. Imagine how they look at you. Is this guy crazy? At that time, when we started in 2011, 12, 13, you had to explicitly define what a game for health is, what a serious game is. No one really understood what you meant. Is this guy joking? We are talking about adults here 25 years or more older, they don't play games. You know, for them, a game is just for 5-year or 2-year-old. So at that time, there's a lot of uncertainty. But you need to find people who will agree on a vision. It's not anywhere, it's just your vision. And often, if you're lucky, maybe you already have some funding, but sometimes you don't have any funding. You just say, you know, we want to do this, but, you know, want to find money. We don't yet have funding for the project. But you need to establish it. And then also we consulted with the internet service provider in Swaziland to actually know the internet speed, the download speeds, and who were using which phone. So we needed to know the distribution of phones in the country, because we wanted to see if people would actually use the game. So we consulted with them as well. And we, of course, searched literature. We reviewed Cochrane Library for interventions for sexual behavior change. We read a lot of systematic reviews, cross-section studies, both in Swaziland and in the region. And also we reviewed serious games already that were already in the space. Actually, 99% of the games we reviewed were outside of Swaziland, or Africa for that matter. And then also we attended a serious games conference where we actually really got to understand the trends of what was happening in the field, because you had many experts from all over the world sitting down for about 3 or 4 days in one conference. So you could meet from morning to sunset. You could meet people who are designing games and talk to them, hear their stories. So it was fascinating. For us, it was part of the needs assessment stage of the game. We also conducted one-to-one interviews. We sat with people we considered our target audience, people we thought that they would use this game. We sat with them and asked what they wanted, if whether or not they would use such a game. And actually, in conducting the needs assessment, we did our own study, the Facebook study. So we realized that people were saying they would actually use information on an interactive platform. In fact, that is why we decided to take this route of developing a game. So those were the steps we took in the needs assessment for Swazi YOLO game. And the next step is program objectives. So the most important things to underline in needs assessment is involving stakeholders and involving their consumer, the people who will use the intervention. So next is program objectives. So we need to set program objectives. And in program objectives, actually, the end goal, the end product of this step is a matrix of change. Is a matrix of change made of change objectives. Change objectives are compiled using performance objectives and changeable determinants. In this way, let me show you. First, for performance objectives, these define what the recipients of the intervention need to do in order to achieve the project or program outcomes. So performance objectives define what the recipient of the intervention needs to do. What is it that they need to do to achieve the goals of the project or the program, right? Specific things. So, for example, if you have someone as your target who has this kind of habit to sit and just watch TV all day, you need to really think very hard in your performance objectives on what they need to do in order to move from here to being active, right? These are very specific things that you need to compile. And then next, in the changeable determinants, the next task is to select important and changeable determinants of described behaviors rooted in the findings from the needs assessment. So, for example, you have the performance objectives and you have the changeable determinants. These both come together to make up the change objectives. of the intervention. So you use a matrix to do this, and this is called the change matrix. So you have the determinant up here. What will determine whether or not this person will change the behavior? For example, knowledge. For simplicity, let's just assume it's knowledge. So they need knowledge. Okay, and what is the performance outcome for this objective? They have knowledge, but what is the performance outcome for this objective? And then from there you design the change objective. You do this for all the performance objectives that you desire to have. So most important part here is to ask what needs to change related to the determinant of the program for the participants to achieve the program objective. Okay. So in our Swazi YOLO experience, we stated the performance objectives and we stated together with timelines. So we wanted to know when they will do this, at what time. And then we used qualitative and quantitative studies, interviews to segment our population, our target population, to gain insights into what we consider to be the determinants of what we wanted to change. In our study, it became very obvious that we needed to focus on perception of risk, because we learned from interviews, from literature, that people were already well aware of the basic facts in Swaziland. They know what HIV is, they know how to get tested, they know how to prevent HIV, for example, using a condom. So people relatively knew these basic facts. So we quickly decided that the problem, the big problem, it's one of the problems, but not the only problem. The big problem is perception of risk. We asked in our qualitative study, we asked people what they thought HIV prevalence was in the country. They told us. Every single one of them in our one-to-one interviews told us that it was very high. How high? They thought even the national prevalence statistics was not accurate. In fact, they thought it was even higher, because at that time everyone knew someone who had at least died of HIV, either a friend or a colleague or something. So they thought it was very high. But then when you ask them, what about your individual risk? What do you think about your risk? And they told, no, for me it's okay. I don't think I can get HIV. So we realized that there's low risk perception, which we wanted to work towards. And then we identified important change objectives, such as I already said, risk perception and intention to change behavior. The next stage is theory-based methods and practical strategies. I hope you are looking back at your steps or tasks that you took and see where you can improve an input. The next is, of course, theory, methods, and practical strategy. You need to decide on which theory and how you're going to deliver that theory, and what are the practical strategies you're going to use for that theory. Of course, I will not spend much time here because you're already well versed in many different theories, but planners seek theory-based methods and practical strategies corresponding to the change objectives. So this is the most important part. The theory should directly relate to the change objective. Because you have a determinant of the change, you have the performance of the objective, then you have the change objective. So you want a theory that will address directly the change objective. This is what helps you to actually narrow down the theories and get to one theory that best suits what you want to do. And at this point, I want to say that actually, okay, let's continue. So next is planning group. The planning group helps in deciding or selecting the behavioral theories as well as the practical strategies. So you get these people to sit in a place and you discuss the change objectives that you've identified, and then you discuss the theories that are related to that, and then you go to a very systematic way to deciding which theory is going to be used. And then the bottom line is to ensure that selected methods address the change objectives, and selected methods should be acceptable to the target audience. Remember, you're targeting a win-win situation. A win for you as an organization or as a designer of the intervention, and also a win for the person who's going to receive the intervention. It's not enough to just design the intervention. It gets completed when you have acceptance and usage of the intervention by the audience and positive feedback. So this is what guides you on what will be your methods and what will be your strategies and what will be theory you would use. So in Swazi-Yolo, we used the theory of planned behavior, specifically the intention, the intent component of that theory, and the health belief model, focusing on the perceived susceptibility in that model. We identified intervention platforms as Android operating systems. So remember, you need to figure out the strategy that you're going to use to reach your audience. So in our needs assessment, we realized that many people are using an Android phone versus all other phones. So we decided on Android operating system. And then we determined that our intervention would be a role-playing, story-based game. Remember, at the start, we just knew that, look, we wanted to create a game to involve them, but we had no idea what kind of a game would be effective. Do we run a simulation? Do we run a shooting game? What type of game? We didn't know. So we only had ideas about this after consulting with the stakeholders and consulting with the game developing company as well as the target audience. And we decided on strategies, the point system, the reward system in the game, and also ensure that the game addresses the change objective is very important. So we linked key decision points in the game to our evaluation plan. So this is also a very important component because evaluation step is at the end, right? But the beauty of this model is that you don't start evaluation here. You don't start thinking about evaluation here. You finalize evaluation at this stage. But all throughout the process, you think about evaluation. Actually, the model is something like this, or the opposite way, like this. So you think about evaluation throughout, you end up having a process that is not just one way, you move through steps like that. Okay. So program design is our next step number 4. And in this step, also you conduct it in consultation. The interesting part in the program design is that your preconceived ideas might be changed. So you might decide very well that, look, I want to change adherence. And the reason for people that are not adherents is that they forget. But after this deliberate process, you may discover that, look, people are not taking drugs because they don't have food to eat. For example, one of our researchers in the lab found out that there was people who were not adherent to antiretroviral therapy related to food insecurity. So it might change the way you think. Previously you just thought, if we just tell them that it's important to take drugs, people will automatically take drugs. So the problem is not knowledge or it's not forgetting. It might be other problem. So at this stage in the design, you actually realize that your preconceptions about the problem is a little bit different about what the actual situation is and what the audience prefers. The mode of delivery might be very different from what you previously thought and what the people actually prefer to have. So you involve stakeholders. At this point in the program design, it is when you design the themes, the kind of broad topics that you want the game to achieve, the intervention to achieve, and the content. If it's a story, what would be the story? What would be the story about? What will it be about? And the scope, what do you want to address? By this time, you would have identified many issues, many determinants of the issues, but you want to scope it down. You want to directly focus on what you will try to focus on. And also the sequences of events, right? So do you want to start with knowledge, perception, or you can just start with perception? You decide during this stage. So at this stage, expect the design plans to evolve. It's a living document. They will change throughout the intervention. So by nature, this step is really interdisciplinary. You, as an epidemiologist or public health official, is not enough. You need expertise from game developers. You need expertise from computer programmers or graphic designers, people who know about project management. So you need to be able to consult and work across teams in a way that you both agree on timelines, on what the costs will be, the expenditure will be, when the deadline of the project will be. Everything you need to decide at this stage, but of course it can change later on. So in Swazi-Yolo, we prepared the documentations when we were in this stage. There are many documents that you need, as you can imagine. There's something called a game design concept note, or the design document, and there's the study protocol, you know very well. The concept note, the design document, is almost the same as a study protocol, but they're a little different. So this one is largely done by the programmers. They explicitly state in this document how the game will be, even before they start creating it. So you can see it on paper. I have close to 150 pages of this document. And then the study protocol and the conditions of terms and conditions of the game use. I was very surprised that I didn't know about this until I was actually at this stage, that I needed to have the terms and conditions for playing the game. I needed to consult with a lawyer. I didn't know any lawyer. Going through university process might take a little bit longer than the time I had, so it was very difficult. But I needed to, design legally sound terms and conditions for playing the game. So at this point is where you come up with this, and then also you start thinking about the promotional brief, the document that you will give marketers or people in the marketing company to design for you. So you need to think about this. You need to write it yourself. You need to be able to write it yourself. I will show you how you come up with that. So the characters in the game were based on the target audience. So we segmented the audience because I mentioned before that the story is not just one story in Swazi-Yolo. It's many different stories. The next scene depends on the decision the player takes in the previous scene. So we needed to design this very close to the target audience, right? So the story is based on the day-to-day life of events in the target country. The language of the story also is developed to mirror the target audience. For example, we use a lot of short language. So for example, there's a lot of to, for example, in the game, we write to like this, right? But everyone else in our target audience writes to like this when they're typing or when they're on social media. So this kind of short lingo that is popular in social media and other forms of online platforms, we needed to learn and actually incorporate in the game, because that's what we learned from the target audience. The first brief, we produced this huge story, properly written language, but it was a bit not so palatable to our target audience. And then also the game has got music. Each scene has got a different sound to it. So it mirrors, it tries to capture the emotion of that scene. And then we also tested the game. This is very important. We conducted alpha and beta test. Alpha and beta test are different levels of the game, the development process of the game, to identify problems and things like that. So the next part is program implementation. There are two parts of this program implementation. The purpose of this step is to develop plans to ensure the successful adoption and implementation of the intervention program, in our case, serious game. Actually, I was very impressed by that component over there. You can see this one that you included. I just wish the other was like this. The sustain part. Actually, at this stage, you have plan for adoption, implementation, and others say sustainability, how the game will be sustained. Do you want people to play just once and leave it, the game, or you want people to play once and tomorrow and tomorrow? You have to have a plan for that, a deliberate plan, how you will get people interested. Actually, game designers have something called the curve of interest. It's designed to capture the player within 30 seconds of opening the game. 30 seconds is even too much. Within a few seconds, you decide if you're going to play the game or not. So maybe most gamers always try to anticipate this curve of interest. For example, in many games, I'm sure you've seen this, they first allow you to play, even if before you register for the game, they allow you to play, and then when you've played enough and you're probably really liking it, something pops up. Please register for this game to continue. They've already captured you. It's a deliberate process. You just rush and register and go back to play. So adoption and implementation performance objectives are outlined. You specify determinants of adoption. Before you specify determinants of the behavior, of the performance behavior. At this stage, you specify the determinants of adoption and implementation. And then change objective, methods, practical strategies, useful adoption and implementation are determined at this stage. And then you also create materials to promote the adoption at this stage. So, for example, you designed a project to help people remember to take their medication. But what determines whether or not someone actually listens or read a pamphlet or play the game? It's adoption. So I actually looked for a definition for this, and I found some definition related to serious games or games in general. So this adoption is defined in just technology. There's a company, an online company, they say they define technology adoption as a process that begins with awareness of the technology and progresses through a series of steps that end in appropriate and effective usage. I like this definition. So they outline 5 steps of this process. So in serious games, I think similar definition can be applied. First, the person has to know about the game. So awareness. But between them knowing to them using the game appropriately and effectively is a long way. There's a lot of things that have to happen between knowing about the game and using the game. Actually, this is now I am having this. I'm experiencing this stage of Swaziolo, thinking very carefully about this adoption. So there are several steps. Maybe I won't go to them. There's awareness. So potential users learn enough about the technology and its benefit to decide whether they want to investigate more or further about the game, for example. And then after that, they do some assessment. Potential users evaluate usefulness and usability of the technology. And after assessment, they decide whether or not they will accept it. Potential users decide to acquire and use the technology or decide not to adopt. Learning. So users develop skills and knowledge required to use the technology. So if it's a game, how do you play the game? There are rules towards the game. Is it difficult? Is it easy? And then usage. Users demonstrate appropriate, effective use of the technology. So there are many steps that as a serious game researcher, you need to think about when deciding. You need to think about the steps. Okay, so for Swazi-Yolo, this is what we are planning to use. So we're going to use a lot of marketing for Swazi-Yolo, a lot, in all online platforms. Maybe in a couple of months, in a couple of weeks, we will fully utilize this. And then you'll direct people to our website. They'll get screened for eligibility. If eligible, they get a chance to download the game, sign informed consent, get randomized into intervention and the control group. So also in Swazi-Yolo experience, we identified the network to promote adoption. We created promotional materials, so video, infographics, and pictures that we're going to use. And then we also published the protocol. These steps really helped us a lot because we got a lot of feedback for our protocol in terms of ethical issues and some methods and strategies that we use. So I'd suggest if you're planning an intervention, please publish your protocol. It's very useful to get early feedback before you start working on the intervention itself. And then the last part that is actually built throughout the intervention is evaluation plan. This actually starts much earlier when formulating objectives. It's a crucial part of any program. The intervention evaluation design already included in the intervention protocol, study protocol. So it includes PECO, right? So your research question has to be clear to anyone, right? And then also your hypotheses, you need to design them in such a way that they are measurable, they are testable, and they make sense from the game. So their hypothesis has to be linked to what happens in the game, the outcomes of the game or the intervention. Then also statistical analysis should be well described. And then measurement tools are well calibrated, they're pre-tested, and they're validated. And then appropriate ethical clearance. And also you test the randomization because we are doing a controlled randomized study. So you test the randomization and make sure that everything works. So we've already done that, and the Swazi-Yolo evaluation plan looks like this. So we have an intervention group and we have a control group. And then we'll expose them to the intervention. Then we'll measure at the end. So most interventions I'm seeing measure just before and after. Then they see an increase, it's effective, it works. Some interventions measure like this, both control and randomized group. I think the strongest intervention design is one that measures before and after for one group and before and after for the control group. And then measure the effect in the difference between the two groups. So this is an example. For example, if you think about certain behavior and the prevalence of that behavior in the intervention group is 19%, in the control group is 19%, right? So baseline can say there's no difference. And then you give the intervention, and then you see 40% in the control, and then you see 22% here. The difference is not, maybe it's not 20%, maybe. The difference is actually the difference between the two. in the intervention group. So this is the intervention design of Swazi YOLO.